Thank you, everyone. My topic is sonodynamic therapy for treatment of C6 glioma in the rat model. Actually, here we use the sonodynamic therapy plus the thermal rise, and just wanted to see the synergy of that treatment. So about a history of photodynamic therapy, they use the photosensitizer and have some treatment of benefit, but the problem is the photodynamic has some limitation of the poor light penetration to the tissue, and also is open surgery. It's not non-invasive. So here we try to use sonodynamic therapy to treat a brain tumor. And sonodynamic is ionizing, radiation-free, and non-invasive treatment, and not limited by the certain expression of a signaling pathway or overexpression of certain proteins or genes. And here we use a 5-ALA. 5-ALA is FDA approved, already used to facilitate that the tumor surgical resection to see the age of the tumor. So here, so the benefit is 5-ALA is we can easily to translate it to the clinical trial if it's. Also, we use the verteporfin to use verteporfin, another FDA approved to be used in the vascular disease of the eye. And what we use here is we use a C6 rat glioma cells from ATCC and use 30 female Vista rats. We inject 3 million cells in the subcutaneous to create a subcutaneous model, and then we wait 7 days and to wait until the tumor getting 1 centimeter in size. So 6 groups mock treatment, focus ultrasound only treatment, 5-ALA or verteporfin only, and the combination of ultrasound and the 5-ALA or verteporfin. So verteporfin we prepared in the DMSO, and also make sure the DMSO concentration is less than 5%. And also we use the tail vein injection to give the verteporfin 3 hours before the sonication. 5-ALA, we use the IP injection, and also 3 hours later, we use the 3 thermometers to inject to insert into the tumor and make sure that in agreement of the temperature. And the treatment plan is we use the ultrasound sonication to 1.1 megahertz ultrasound, and the natural focus is about 2.3 centimeter, and to maintain that the tumor temperature about 42 degrees for 20 minutes. Then we observe the animals for 7 days after sonication. Here's the system we use, and here's the animal, the model. So we make sure the 3 thermocouple have the temperature measurement within 2 degrees. If not, then we reposition the thermocouple. So here's the primary outcome is we want to see the necrosis caused by the synergistic treatment of focus ultrasound and sonodynamic therapy, the thermal rise and the sonodynamic therapy. So here we just use that the ratio of the nuclei, and we calculated use the Nikon Elements software to calculate the total area of the nucleus as a unit of pixels, and divided by the area of a region of interest. Just want to see, and if the number is lower, that means more necrosis. So here's the tumor model, and we can see the histology is without a treatment is a normal glioma presentation, and if you treat it with ultrasound only, pretty similar as the mock treatment. Verteporfin plus the ultrasound, you can see that the pinkish area of that necrosis, compared to the vertiporphin only on the right side. And the 5A, similar result is 5A plus the ultrasound and compared to the 5A only. So here's just another example of 5A plus ultrasound versus ultrasound only. So there's one rat we found that 1 week after the vertiporphin plus the ultrasound treatment, and we see that the tumor almost disappeared. Then here's so we look at that the relative indirect measurement of necrosis. So we can see that at the right side, the 5A plus ultrasound and the vertiporphin plus ultrasound are significantly lower than compared to the control groups. And here, just want to show that truly the vertiporphin injection and just make that the skin more sensitive to the ultrasound, and this is only seen in the vertiporphin treatment group, but not in any other alone or either sondication only or the marked treatment. So ongoing experiment is we're going to test the apoptosis using the Midpore kit, and it's ongoing now. Thank you.
Thank you. Quick.
Would you show me the type of the transducer? Is it plain or focused? It's a. It's a plain or curved, focused?
Is it a focused transducer or?
It is not a focus. It is not a focused.
It's a focused transducer.
Unfocused.
It's unfocused.
Okay, I see that.